Hi everyone, this is Dr. Brooke Patterson, and this lecture is an overview of the cardiovascular system. This lecture begins with an overview of the anatomy and physiology of the heart and cardiac system. This, however, should be a review for you, and the rationale for the review is so that you can understand how assessment and the A&P are tied together. In reviewing the A&P, pay attention to the heart and blood vessels, specifically the location of the heart and different sounds in relation to where you will be assessing. The main functions are the delivery of oxygen and nutrients to body cells, the removal of waste products, and maintaining perfusion to organs and tissues. The top two concepts of the cardiac system are oxygenation and perfusion. As we start talking about the respiratory system and other systems, you will see how these systems and concepts all link together. There are three layers of the heart wall. The pericardium is the outer layer which protects the heart. The myocardium is the middle muscular layer, and the endocardium is the inner smooth layer. You will hear terms such as pericarditis, myocarditis, or endocarditis, which all refer to the layer of the heart affected. This picture is helpful in visualizing the cardiac chambers, valves, and the route of circulation. The cardiac cycle consists of a measurement of ventricular pressures. Systole, or the period of ventricular contraction, and diastole, the period of ventricular relaxation. Note that these two pressures are associated with the ventricles and give you your blood pressure values coordinating with systole being the top number and diastole being the bottom number. You will see that the location in which you hear the valve the best mirrors its actual anatomic location. In this picture, you can identify the four important locations that we will listen to when auscultating the heart: aortic, pulmonic, tricuspid, and mitral. While we won't be going into detail regarding the conduction system of the heart, I do want you to be familiar with the wave pattern that you will see on an EKG. Our first question asks us, which of the following are the main functions of the cardiovascular system? Choose all that apply. A, delivers oxygen to tissues. B, removes waste products from the tissues. C, maintains perfusion to the body tissues. Or D, assists with maintaining body temperature. The answers are A, B, and C. The main functions of the cardiovascular system is to deliver oxygen to the tissues, remove waste products from the tissue, and maintain perfusion to the body tissues. While it does have a significance to thermoregulation, it is not the main function. A cardiac health history is so important and can uncover many different conditions and illnesses associated with not just the heart, but other organs as well. A patient complaining of chest or neck/arm pain may be experiencing angina pectoris, coronary artery disease, a myocardial infarction or MI, or acute coronary syndrome. I also wanted to bring attention to the fact that women who are experiencing cardiac issues may present differently. Not to say that they still can't have chest pain, but they may also have symptoms such as nausea, sweating, and/or feeling anxious. Be sure to read about the different atypical symptoms and potential different MI presentations. Other symptoms may include palpitations. These may be described as their heart skipping, racing, or fluttering. Palpitations could potentially uncover dehydration, electrolyte imbalances, and/or arrhythmias. When you think of shortness of breath, you may think about the respiratory system. And while that is true, these two systems especially are interconnected. With heart failure, due to the backup of fluid into the lungs, a patient may experience dyspnea or shortness of breath. With heart failure, in addition to dyspnea, common complaints are cough and edema. Edema can also be characterized as dependent, meaning that the fluid follows gravity. So if a patient is sitting in their wheelchair all day, they may have dependent edema in their feet. Edema can also occur due to low albumin levels and may be corrected by increasing protein intake and/or a dietary nutrition consult. Make sure you are familiar with how to grade edema. I also want you to know the difference between peripheral and central edema. Other cardiac symptoms include fatigue, cyanosis, and pallor due to decreased oxygenation. Most of these cardiac symptoms overlap with other conditions, which is why it's so important to complete a thorough health history and physical assessment combining both subjective and objective indicators when thinking about potential pathologies and planning priority actions. After completing a set of vital signs and obtaining blood pressure and heart rate, no matter what the system, your assessment sequence will always begin with inspection. You can also gather a lot of pertinent information in the general survey portion. You can start by noticing the patient's verbal and nonverbal communication and body language to determine if they appear overly anxious. While talking with them, you can note the patient's face and skin to detect cyanosis or pallor and the presence of orbital and facial edema. You will also inspect the precordium or the area around the heart. We will learn more about inspecting and palpating the chest in lab. In lab, we will learn how to palpate and auscultate the carotid arteries with normal and abnormal findings. You will auscultate the carotid arteries with the bell of the stethoscope. You will also check for thrills and bruits. I want you to know the difference between a thrill and bruit. During palpation of the carotid artery, humming vibrations or thrills that feel like the throat of a purring cat may be detected. Bruits sound much like a murmur in that it has a swooshing sound. A bruit most likely indicates carotid or aortic stenosis or narrowing, potentially due to accumulated plaque. Make sure you palpate and listen to both sides, but unlike other systems, you won't palpate the carotid arteries at the same time because this could potentially impede the brain from receiving adequate blood flow. While in this course, we will not practice how to measure jugular venous pressure, but in lab, we will learn to assess if a patient has jugular vein distension. While the client's head of the bed is at 30 degrees, we will politely ask them to turn from left to right to examine the veins of the neck to determine if distension is present. Distension will be present if there is an increased pressure in the vascular system and will most likely be reflective of a patient with heart failure and/or who is experiencing fluid volume overload. This picture is also helpful with the anatomical locations in relation to their specific intercostal spaces. The apical pulse, also known as the point of maximum impulse, or PMI, is palpated directly next to where you hear the mitral valve, at the fifth intercostal space mid-clavicular line. Location and diameter are important because if the PMI is displaced, this would indicate cardiac hypertrophy. To count the apical pulse, you will place your stethoscope in this location and count for a full minute. To administer certain types of cardiac medications, like digoxin, the electronic medical record will ask you to document the apical pulse prior to administration. There will be defined parameters of when to give the medication as opposed to holding it. Digoxin is just one example. When auscultating the heart, we will use both the diaphragm and the bell of the stethoscope. Murmurs, or low-pitched sounds, can be heard best using the bell of the stethoscope. S1 will be the first heart sound that you hear. It is often described as a lub. S2 will be your second heart sound. It is often described as a dub. Although for the purposes of this course, you don't need to be able to identify extra heart sounds like S3 and S4, I do want you to know that these are found in different pathologies. Once you learn to identify S1 and S2, you will then be able to recognize abnormal or additional cardiac sounds. In lab, we will learn to listen to the heart in a sitting position, but in a clinical setting, you will have to adapt the cardiac exam to your patient and their preferred positioning if immobile, in pain, or have difficulty changing positions or are intubated. If you're having difficulty hearing a sound or certain sounds, if the patient is able, you can assist them with a lateral position or leaning forward. Oftentimes, these positions will help accentuate the volume. While you do not need to memorize the different types of murmurs for this course, I do want you to be able to identify what a murmur sounds like, its location, and be familiar with the different intensities. While grading murmurs takes lots of practice and can often be subjective, I want you to know that murmurs can be graded on a scale of 1 to 6. Grade 1 being very faint with a grade of 6 being the loudest. You do not have to memorize this chart. The nurse has key roles in screening, teaching, and educating patients while encouraging lifestyle modifications. This slide, along with the next slide, describes different lifestyle modifications to prevent and manage hypertension and/or cardiac disease and stroke. I think that you will find many of the modifications overlap. One thing I did want to point out is that although this slide discusses salt limitations, I do want you to understand that certain patients are more reactive to salt than others. Also, lifestyle and diet are modifiable risk factors. However, many patients have non-modifiable risk factors. For example, a patient may have a healthy weight, diet, and activity level, but still develop hypertension and/or cardiac disease based on genetic risk factors. That is why a family health history is so important, because it may be necessary to screen patients for these diseases earlier or more frequently. This slide just outlines further lifestyle modifications and prevention strategies. Thank you for reviewing this lecture. If you have any questions, please reach out to me.